Nervous System Part 3. The sensory and motor functions associated with the arms, trunk, and legs are conducted by neurons in and projecting to the spinal cord. The central core of the spinal cord is surrounding a central canal that is filled with cerebral spinal fluid, is gray matter that is composed of cell bodies of projection of neurons and interneurons. The central core is surrounded by white matter and made up of myelinated and unmyelinated axons of ascending and descending tracts. The dorsal region of the spinal cord consists of dorsal columns, which are white matter, and dorsal horns of gray matter. The region primarily serves the sensory functions. The ventral region of the spinal cord consists of ventral white matter and ventral horns of gray matter. This region primarily serves motor functions. The lateral white matter contains both sensory and motor tracts, and the lateral gray matter at the thoracic and the sacral levels contains sympathetic and parasympathetic preganglionic neurons. Peripheral sensory fibers respond to external and internal stimuli like touch, vibration, cold and warm, and pain, and this is through ascending pathways and synaptic relays that bring those stimuli to the conscious awareness in the sensory cortex. The sensory neurons are also referred to as afferent neurons because they are bringing information into the nervous system. The specialized sensory nerve endings come to the threshold in response to their specific stimuli, generating action potentials that are propagated to the cell body and into the central nervous system. Spinal sensory neurons have specialized axon terminals in peripheral tissues. For instance, it's the skin, muscles, joints, and organs. These axons are where action potential is generated. The action potentials are propagated to the cell bodies in the dorsal root ganglion outside the spinal cord and to the central axon that enters the spinal cord through the dorsal root. Some of the axons make an immediate synapse in the dorsal horn, while others ascend or descend in the dorsal spinal cord before reaching their synaptic termination. Large fiber modalities of fine touch, position, sense, and vibration are carried by axons that enter through the medial dorsal root, bifurcating into branches that either remain in the spinal cord or ascend to the brain in the dorsal columns. Small fiber modalities of pain and temperature are carried by axons that enter through the lateral dorsal root, bifurcating into branches that can ascend or descend within the spinal cord or can make an immediate synapse in the dorsal horn. The dorsal side of the spinal column faces the back of the body, and it is related or used for sensory functioning. The ventral side faces the abdominal side of the body, and it is used for motor functioning. The heavily myelinated dorsal column fibers are vulnerable to demyelination in several vitamin B deficiencies, producing sensory deficits of light touch and vibration sense, and decreased sense of proprioception, causing difficulty with maintaining balance as assessed by the Romberg test. Pain is the most common reason that a patient will visit a healthcare provider. Acute pain is important for an individual's awareness to an area of injury and for enforcing rest of the injured part or aspect of the body to allow healing. Chronic pain is disabling and more likely to result in chronic dysfunction, not healing. The perception of pain, also known as nociception, allows the central nervous system to alert the body to injury and impending danger. Nociceptors are known as first-order neurons. These are peripheral sensory neurons, and they are activated by tissue-damaging stimuli. They have relatively unspecialized, bare nerve cell endings that initiate the sensation of pain. Nociceptors transduce a variety of stimuli into receptor potentials, which then trigger action potentials. Nociceptor axons are further broken down into various groups of myelinated axons and unmyelinated axons. The nociceptors release glutamate at their sympathetic targets, and many can also release the transmitter substance P. Glutamate produces rapid excitation of second-order neurons, and substance P produces slower and long-lasting excitation. Known as second-order neurons, spinothalamic tract neurons are located in the spinal cord dorsal horn with axons that project to the thalamus and brainstem. In the dorsal horn, the axons branch and make excitatory synapses on the spinothalamic tract neurons. The greater the stimulus, the greater the excitation and action potential frequency of the spinothalamic neurons, therefore coding more severe tissue damage. The nerves that innervate the skin are composed of 4 various types of axons. The efferent C fibers of the sympathetic postganglionic neurons control cutaneous vasoconstriction. Peripheral nociceptors are bare nerve endings with receptors sensitive to inflammatory mediators and signals of tissue damage. The action potentials initiated at the peripheral sensing end are propagated to the dorsal horn synapse with the second-order neuron. The nociceptor neurons synthesize substance P and calcitonin generated peptide, or CGRP. It also synthesizes peptide modulators that can be released as transmitters in the spinal cord, and the neurons can also be released from the peripheral branches of the nociceptor. The local release of substance P and CGRP into adjacent tissue stimulates vasodilation and mast cell degradation. This contributes to local edema and pain, as well as promoting a peripheral sensation. The descending pain modulating pathway can regulate the transmission of pain signals to higher brain regions. The key brainstem region that produces the descending inhibition is the PAG. Neurons in the PAG project to the medulla and specifically target neurons containing norepinephrine or serotonin, which then project onto the spinal cord to modulate the pain transmission in the spinal cord. The flow of nociceptor information through the spinal cord is moderated by simultaneous activation of the large myelinated fibers associated with low threshold mechanoreceptors known as the gate theory of pain. Descending inhibitory pathways involving the PAG can be activated by opioid analgesics and by endogenous opioids. All of the endogenous opioids, enkephalins, endorphins, and dynorphins are present in the PAG. At the level of the spinal cord, enkephalin is released from interneurons specifically and act to inhibit the release of substance P and glutamate from the primary sensory neuron. Pain modulation can take the form of increased pain sensations, which is referred to as sensitization. The first is primary hyperalgesia. This is a state in which the stimulus that ordinarily would be perceived as only slightly painful is perceived as very painful. Central sensitization is an immediate onset, activity-dependent increase in the excitatory neurons in the dorsal horn following high levels of activity in the peripheral nociceptor nerve fibers. The stimuli are under normal conditions would be painless, activate the second order neuron in the dorsal horn and present a sensation of pain. The indication of pain by a normally harmless stimulus is referred to as allodynia. When nerve fibers or pathways are impaired, as in diabetes or multiple sclerosis, these processes can persist, resulting in a condition called neuropathic pain. Neuropathic pain can be elicited by non-painful stimuli, and it's often described as a persistent burning sensation with intermittent periods of shooting, stabbing, or electric shock-like jolts. Inflammatory mediators are the key amplifiers of the nociceptive response to injury. These are a class of highly prevalent pro-nociceptor mediators known as prostaglandins. Suppression of prostaglandin synthesis at the site of inflammation is the primary mechanism of the analgesic effects of non-steroidal anti-inflammatory drugs. Opioids modulate pain when bound to opioid receptors on neurons located throughout pain pathways by inhibiting the transmission of pain signals. In patients that present with chronic low back pain, chronic neck pain, knee and hip, osteoarthritis, fibromyalgia, and chronic tension headaches, modest improvements in function and pain were achieved with non-pharmacologic therapies. Many of these therapies can include exercise, psychological therapies, physical modalities, modifications, manual therapies, mindfulness, mind-body practices, and multidisciplinary rehabilitation. Electrical activity in the photoreceptors is transmitted to bipolar cells and then ganglion cells with axons that form the optic nerve, cranial nerve 2. Eye movements and innervations are controlled by extraocular muscles innervated by cranial nerves 3, 4, and 6. The left portion of the visual field projects to the nasal retina of the left eye, and the temporal retina of the right eye, while the right portion of the visual field projects to the temporal retina of the left eye and the nasal retina of the right eye. Disorders of vision can occur from various diseases of the eye, including macular degeneration and glaucoma, various nervous system disorders, multiple sclerosis, stroke, or tumors, or from systemic disorders like diabetic neuropathy and thyroid eye disease. The ear is divided into three components: the outer, middle, and inner. Upon depolarization, the hair cells release glutamate. This creates an action potential in the adjacent cochlear sensory nerve endings. The axons of these cells travel in the cochlear nerve, cranial nerve 8, to the brainstem. Hair cells are lost with aging, contributing to age-related hearing loss, the most common sensory deficit. Initially, the loss is restricted to high-frequency sounds and does not noticeably impair speech perception and communication. The losses are progressive and can gradually limit conversation and social functioning.